Hello, everyone. Welcome to this episode of Criminal Mischief, the Art and Science of Crime Fiction. I'm your host, DP Lyle. Today, we have a very fun Q&A for you. Great question asked by a writer friend of mine with some fun stuff. But let's start with something that we all know. It's part of the American lexicon, if you will. It's part of literature. It's part of movie history. It's part of everything. And it is, well, Alice in Wonderland. Um, Everybody knows Alice in Wonderland. Everybody knows that story. You know, Disney made obviously a huge movie out of it. A lot of other people have done it a lot of different ways. It was written actually in 1865. Think about that, by Lewis Carroll. And so it's one of the most endearing stories in American literary history. Um, so much so that it even bled on over into the 1960s with absolutely one of the greatest rock albums ever made, Surrealistic Pillow by the Jefferson Airplane. I remember when this album came out. I am of an age, so I remember all this. I was in college. And the songs on it are just incredible. The whole band, everything about it blew me away, blew everybody away. It's one of the iconic albums in the history of rock and roll. But there's a song on there done by Grace Slick. I think it was written by her too, called White Rabbit. And it echoes right back to Alice in Wonderland. It opens with one pill makes you larger and one pill makes you small. And the ones that mother gives you don't do anything at all. Go ask Alice when she's 10 feet tall. And if you remember all the things that went on when Alice was in Wonderland, uh, and a lot of it was distortions of various types. So, what on earth does this have to do with medicine and forensics and crime fiction, et cetera, et cetera? Okay. Well, I got this wonderful question from a writer friend of mine, and she had a question about what's known as Alice in Wonderland syndrome. That sounds fascinating, and we're going to talk about it. Now, she knew a bit about it. She had done her research, and she knew it was fairly common in children, that it was common among migraine sufferers, and that it could be controllable to some extent if you control the migraine. So she had, like I said, she had done her research. What she wanted is for her character to have certain side effects. So even though this character was on medications that was helping the migraine syndrome, which we'll talk about, and it was fairly much under control, but she wanted him to develop some erratic behaviors, such as insomnia and irritability, and she wondered if he could perhaps be dosing himself with some medicine or some kind of herb, or would there be side effects from the treatment that would make all of these things come about, and that he would become increasingly unstable. And therein is the story. So, what is Alice in Wonderland syndrome? What exactly is it? Well, it's also known as Todd syndrome. It's a neurologic condition, and it's associated with disorientation, particularly as far as size and distance perception. Now, we have big words in medicine for everything. We have micropsia, which means things look smaller than they actually are. We have macropsia, which means things look larger than they are. There's pelopsia, which means things look closer than they really are and not like the rearview mirror on your car. And telopsia, which means they look further away than they actually are. So the sufferer of Alice in Wonderland syndrome that develops these symptoms could easily have any combination of these things. Things could look large, they could look small, they could look further away, they could look closer. And yes, this is associated with migraines in many situations. Now, migraine syndromes are neurovascular problems. They have to do with blood flow in the brain and spasm of the arteries and the neurologic effects that result from that. And migraines are horrible. They can put people in bed for hours or days. And anyone who has them or has suffered them knows this all too well. There's a ton of medications out there to treat them. There's a ton of medications out there to prevent them, but still they break through and people have migraines and they're horrible. They also have neurologic side effects. And often there's an aura. Someone will hear a bell ringing or maybe smell an odor, or they will sense something in their sensory world that will let them know this migraine is coming. And we call those auras. Also happens in certain seizure disorders. So auras are out there. Well, you can see that someone who has a migraine syndrome could develop all of these distortions that we see in Todd syndrome or Alice in Wonderland syndrome. It could easily happen. And so it is more common in younger kids and than it is in older adults, but it does happen. So it can also be associated with things like poor coordination, sound and touch sensory disturbances, emotional instability, which fits right into the question. And it can also develop a depersonalization syndrome. And this is really an odd deal. A depersonalization syndrome is kind of where the person feels disconnected from themselves. They kind of step out of themselves. Many people who have one of these will have a sensation that they're usually hovering near the ceiling of the room or the place that they are and looking down on what's going on, including themselves. This is seen in anesthesia. People wake up from surgery and say, well, I was on the ceiling, watch this whole thing. It happens. Certain drugs can do it, particularly hallucinogenic drugs. PCP was notorious for doing it. So all of these things can happen. Now, the symptoms of Alice in Wonderland syndrome are very episodic. They happen when they want to, and they don't when they want to, and they're not necessarily associated with other migraine symptoms. The sufferer of this is usually aware of what's going on. They know that what they're perceiving is not reality, that things are distorted, that that's really closer or that's really smaller. And so they are aware that things aren't like they should be. Okay. Um, it can be associated, as I say, with migraines, but also with tumors and with head trauma and certain infections like viral encephalitis and certain drugs can cause this, particularly psychoactive drugs that we'll talk about. Now, the treatment for this is standard migraine therapy, which consists of several things. To get the easy ones out of the way first, beta blockers and calcium channel blockers. Now, those are medicines that are often used in cardiac arrhythmias and in hypertension. And beta blockers can make you tired, fatigued, and forgetful. And calcium channel blockers don't have that many side effects, particularly psychoactive side effects, neurological or psychological side effects. So let's forget those. But the other groups of medicines that are often used are anticonvulsants and antidepressants. So anticonvulsants would be things like Dilantin and the benzodiazepines like Valium and Xanax, and they're often used in migraine syndromes. Okay, and then they can afford some help. The antidepressants are things like the SSRIs, the serotonin reuptake inhibitors, they're called, like Lexpro and Prozac, are like the MAOIs, which is monoamine oxidase inhibitors, and they can things like Marplan and Nardil, and there's others. And then there's that group of tricyclic antidepressants, which are things like Elavil and Topranil. You've probably heard of those. Well, all of these neuroactive drugs, these psychoactive drugs, have tremendous side effect profiles. They can cause insomnia and irritability and impotence and confusion and disorientation and hallucinations and delusions and bizarre behaviors of all types, sometimes aggressive and sometimes quite depressive and passive. But they can cause all of these kinds of side effects, and they're the drugs that are being used to actually treat the Alice in Wonderland syndrome. So you can see that the writer, she wanted these certain things to happen. Well, they can happen as a side effects to the medications to treat Alice in Wonderland syndrome. Well, what about herbs and recreational drugs and things like that? How would they play into this? If he either dosed himself and didn't know that he was exacerbating all these things, the character, or someone was doing it to him to manipulate him, to make him seem crazy and unstable, which, it'll happen with these things. Well, cannabis, of course, marijuana is a psychoactive drug. Mushrooms, whoa, wow, psychedelic mushrooms. Speaking of Jefferson Airplane and the Haight-Ashbury during the 60s, LSD, of course, ecstasy, and the ton of other hallucinogens out there that can do this. So they could all do that. So in this situation, this character has migraine syndrome and has Alice in Wonderland syndrome. And so episodically has these distortions of perception and maybe other symptoms too. And so they may be put on a medication for this, and the side effects of the medication start gradually increasing because medications do that. They become cumulative and additive. Maybe they're on both an antidepressant and a anticonvulsant, and the two interact. And so these side effects, irritability, anger, acting out, confusion, disorientation, all these things could gradually increase over time. And the victim may not notice this as much as the people around them do. So, depending on how the story goes and how she wants her story to unfold, all these things are possible. So, this person could also be taking the other psychoactive drugs, LSD, ecstasy, mushrooms, whatever, for recreational purposes, or maybe to alleviate some of the symptoms, or maybe to alleviate some of the side effects of the medicines that's being used to treat this syndrome. So this is a great question. Alice in Wonderland syndrome is unbelievable. I mean, it is just crazy. And it's such an odd syndrome. I don't know that I've ever seen it in my medical practice. And probably the neurologists get to see more of it than those cardiologists do. But it's very fascinating. This was a great question. And I hope that it sparks some ideas for you out there that you would go read more about this, look into all of this, and say, maybe I can use this in my story in some form or some fashion. So, wasn't that fun? So we'll be back. I'll have more questions and answers and more programs here on Criminal Mischief. So until then, I want you to keep writing and keep reading and keep having fun. And of course, try not to get caught. I'll see you next time.